All right, so welcome to the practice. What can I do for you, sir?
Thank you. I suffer in my chronic migraines.
Okay.
And hope you can help me.
Well, I hope so too. How long have you been having these migraines?
Oh, I would say almost 40 years.
40 years?
Yeah.
Geez, that's way too long. So when you get these headaches, these migraines, okay, is that with the aura or without it?
Sometimes with, sometimes without.
So okay, got it. So sometimes with and sometimes without. And where do you usually feel that migraine headache?
Starts from the side of the right side, down radiate to the neck, shoulders. Sometimes it goes to the left eyes. Yeah. And then it becomes blurry, and I could basically see like half your face. The other is like basically blacked out until it takes its course.
Oh yeah, okay, so that's definitely migraine right there. Yeah, that's a serious one. Okay, so we're gonna investigate, see what's going on with that. I'm gonna break it down to you in terms of what we're looking for, right? So when the structure first damaged like this, all right, it gets knocked out of alignment, it starts irritating that nerve, and our body does some several defense mechanisms. It's no different like our head. If our head is like knocked out of alignment like this, okay, how can we rebalance like this? Well, the muscles on this side will work very hard to try to pull it back in proper alignment. So therefore, my expectation is part of the examination, I'm gonna look for, is there any muscle tightness on this side? In addition to, I'm also gonna look for some swelling, all right? Because when this gets knocked out like this over here, it damages some of that tissue, and that's where that inflammatory response happens, and our body is trying to repair and stabilize this fellow over here. So I'm gonna look for muscle tightness and also swelling. And on the opposite side, since this is gonna be tight, my expectations, this should be loose, all right? So let's take a look, see what we got on you. So already right off the bat, there is a lot of swelling, quite a bit. And you feel that huge knot?
Yes.
See, there's a big muscle knot right over here. So we have to investigate what's going on with that. You feel this over here is nice and smooth.
Yeah.
Yeah, see? And again, you have some muscle knots here as well. So clearly your body's trying to stabilize something right at this level right over here. Same story as this over here. Everything is muscle spasm. See, there's a lot of muscle spasm on this side, tightness. And I see it over here as well. I'm gonna mark that level. You have a pinning edema. See, when I trace it, it just sinks right in there, right at that level. And another one sinks right over here as well. So we're going to investigate these particular levels right here. Keep on tracing going straight down. And see, you got a little swelling right here. That looks like that second lumbar, but that's usually compensation, biomechanically speaking. And looking further down, okay, I see a lot more swelling on this right side joint. Yeah, right there. So the next thing we're doing here is we're scanning your spine here with this instrument here. And we're looking for those potential levels of abnormal heat temperature. Because when that damaged tissue occurs and the inflammatory response happens, our body initiates that inflammatory response, increase more vascular supply to the area, and as a result, you'll have more heat. And that's what this device helps pick up. So let's see what else we got going on. Keep on tracing all this right down. Yeah, so right there. Okay, let's see what's going on over here. Right there. Not too bad, docs. So next component. How's this fellow over here? Tender?
Yes.
Okay, so since it's tender and there's swelling and edema at the sacroiliac joint over here, that's a pretty good indication that this is a potential issue that we need to investigate thoroughly. Comparing it to the X-ray, that this is actually a very strong cancer we need to address. So let's check your left SI joint. See, that's moving just fine. You see, right now what I'm doing is I'm overlaying the X-ray image in my head and overlaying the data I'm accumulating from the patient right now. See this right hip? It's not moving. See right there? This ilium over here, it's stuck. It's not rotating IN or EX at all. See, it's not even moving PIAS at all either, completely locked up. Now we're gonna check the lower lumbars. See, that's not moving at all either, that fifth lumbar. Fourth is stuck. See, 3's moving, 2 stuck. You know, it's like a brick wall. That's no big surprise, given that all that arthritis we see in the X-ray. Oh, this poor fellow right there. That's 6 dorsal. Not too fun right there, huh? Pain?
Feels good with the pressure.
Now we're checking for the swelling in your neck. Feel that knot right there?
Yeah.
Yeah, right? What about this fellow right there?
Oh, yeah.
Big time, right?
Yep.
So we're checking that. See, there's that fifth cervical. That ain't moving. How's that right there? Pain?
Yeah.
Yeah. So you have a little swelling right there at the occiput. Feel that right there?
Yeah.
Yeah. Okay, we'll keep an eye on this fellow over here. Now we get to piece all the data together. All right, we already accumulated information in regards to where there's the muscle spasms, the swelling, the heat, what's moving, what's not moving, X-ray data. I already saw you before how your walking gait and your posture, how you carry yourself. So overlaying all those layers of data. Well, yes, we also talk about your history where you talk about, okay, I got pain radiating from headaches from here and here. That's a trapezius muscle pain referral pattern itself. That's one component that tells me, okay, there's something going on this right side over here, the trapezius muscles. But we also saw, and what I saw as well, you got muscle spasms on both sides. So clearly there's something unstable here. Now, as we see over here, your spine is curving this way. Why is it curving that way? Well, only it's going to curve that way is if it's twisted like this. So do we want to adjust right in the middle of that? That's not exactly a good idea, because when we untangle that and then let it go, boom, it goes straight back here again. Would it make more sense to, why don't we just untangle from the bottom? So looking from here, I'm tracing that all straight down. And I'm seeing this is curving this way, curving that way, this way, and coming down over here. From the left side, this right hip, it's sinking down this way. It's also rotating a little bit this way as well, because this line over here is slightly this way, but when I compare the width over here and this is more narrow. This is a little more wider. So that tells me biomechanically your hip, your pelvis is rotating like this way. And also sinking down that way and backwards this way. So you tell me, how well can you walk this way? That's going to be a tough thing to do, right? So our body has to compensate from this, twist like this. Is that boom, got a level, center like this way. So that's where we start to see this compensation go like, okay, got to go this way. So that's not solving anything. Hey, got a center level like this way, to this way, down, this way, this way. So that's what we're seeing all these changes here. Go to the right, follow this foundation here, left, right, left, right, left, right, left, right, all the way because of this fellow over here, okay? Now, it's other interesting components that we uncovered during the history is the fact that you played football, more like, the rest of the world football, okay? But here, American soccer, right? So you're an amazing, strong kicker. And that explains, because what I'm seeing here is there's a lot of changes here. And the reason why it's happened because you kick so hard with your leg muscles. It's just an interesting tidbit, just that your muscles actually is trying to yank right off the bone. So that's why I'm seeing all these jaggeds going on over here. Okay, so you must have one heck of a sartorius, your quad muscles and everything else, including your groin muscles, because that's impressive to make all those, all those nice little, those changes right there. Now, other component I'm also seeing is is these fellows over here as well. Okay, this is a little more backwards than I like to be, and that's causing some instability because normal, I want to see this liquidable bearing has to be smack in the middle. All right, but when the disc itself gets damaged, that's where this nucleus pulposus, it goes backwards, and I see it here with this nice little circle shape right there. You also have a circle shape here, and it keeps on going all the straight up, even up to your neck here. See, circle, 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 circle. And now also comes down to where's the migraines coming from? It's also coming from here. Okay, at this foot circle right over here. This fellow over here is so swollen, it's also going backwards as well. So when it goes backwards, right, I wouldn't be surprised why it's irritating all those nerves. Okay, and in addition to, I also see the occiput is slightly rotated. This fellow over here, it should be parallel to here, but this is more like not the backwards a little bit that way. Okay, so why is that important? If you could imagine, the center of this post over here is your brain stem, okay? And I just want to let you know a little tidbit information. Our three brains, one over here, the second one over here, the gyroscope, but we have a brain stem goes all the way this far down into the neck, okay? So therefore, it's very important when this brain stem goes right through the foramen magnus over here, magnus foramen, okay? What we call the big hole over here, it has to be smack in the middle. When this skull itself misaligns and goes this way, it has a potential to irritate the back part of the skull. If the skull misaligns go on the front part, it could irritate the front part of the skull. Okay, so it's not a huge misalignment with your occiput, with that skull, but I do see it's like, yeah, it is slightly, misaligned. I would expect, and that's what we confirmed on you, you do have a little swelling on here. So that's possibly compounded the problem. Let's address this one first, and I want to see biomechanically what it does to change this. Okay. We may have to adjust that one, but I prefer not to. Okay. Most likely we may have to adjust that in the future visit, or most likely not. I see more likely this is like a 5-10% chance we may need to adjust this one. Most likely it's just compensating because of this fellow over here. All right. And the other components that, again, piecing together the history, we were playing football, soccer, that is, sometimes you headbutt the ball from time to time, right? So by doing that, no big surprise why it may be, may have knocked and misaligned the skull off of the rest of the spine, right? So, but first things first, let's go ahead, let's take care of the major ones first. Let's take this one over here, we'll check what's going on over here, the sixth dorsal, the second dorsal over here, that fifth circle over there as well. There's that clunker. Okay, walk around.
I feel this up here.
Yeah, go ahead, walk around. Give me some feedback. Tell me what's different in there.
Yeah, it feels a little looser.
A little looser in the low back?
Yeah.
How's the neck feeling?
It's okay.
Any changes or differences you notice from there?
Not yet.
Not yet, fair enough. Okay. Let it go. Wait. There it is. Are you still there? Sixth dorsal. There's that fella. Okay, so that's a pure high spot. Okay. Gotta get a little more deeper. Relax shoulders. A little more. All right. There it is. Hold on. I gotta feel the liquid ball bearing where it moved. Right there. Right. There's that clunker. Okay, walk around, sir.
Ooh, feel different.
What's different about it?
Feel lighter, more easy.
Okay.
I can, ooh, even the back feel a little different.
How's the neck feeling?
I mean, with the initial thing, it's like, much better.
How's the pressure from the shoulder to the head?
It's hardly there.
Nice. How's the pressure on the eye and everything else?
It's much easier.
Much easier.
Yeah. I can actually see the the bottom line, number 16 there, post-femoral gland, and that's usually I need the glasses for that. The blurriness is gone. Wow, thank you.
Oh, you're very welcome.
And that's only one, right?
Yeah, that's just the first visit right there.
Yeah.
So another tidbit I also want to share with you, that fifth cervical nerve level also deals with nerve innervation, the parasympathetic and the sympathetics to your eyes and your ears and your hearing, okay? So it's all connected. So that's why for some patients with migraines or auras, they may be having some auditory issues and vision issues, all connected at that particular level right there. Okay. So in the following visit, okay, in the meantime, I need you to follow our cold pack protocol on this one. Calm down. Let's pump more swelling out of the way. The following visit, you give some feedback. Let us know how the migraine with the aura is coming along. All right?
Okay.
All right, man. You all set? I'll see you next time.
All right, thank you.
Oh, you're very welcome. Okay. So, give us the latest updates. How's everything coming along with the migraines and everything?
It's much better. Less headache, the pressure around my neck, the base of the skull, it's gone. My eyesight is the blurriness is off. A lot of relief.
All right. What about that, the partial loss of vision?
Well, that's only when I have severe migraines.
Oh,
yeah.
Okay. And how's that?
To be honest, I haven't had one since.
All right. Hey, that's great.
Yes. Normally a slight pressure headache, but other than that, I haven't had a serious migraine in a week, which was wonderful.
All right. What's the longest you had in between the attacks?
I usually maybe say 2 weeks.
Okay.
Yeah, right. And then it starts gradually.
Gotcha. All right. Well, this is a great update. Okay.
Yes.
So we'll keep on chipping away at the problems. Keep on stabilizing your spine and restore your nerve function. All right.
Thank you.
Okay. Thank you. All right.